my name is Dr. Vera Tarman, and I am an addictions physician working out of Toronto, Canada. Did you know that the plant species Cannabis sativa, commonly known as cannabis, has been used by humans for over 5,000 years? What makes this plant so appealing, and what are the implications of its use? Cannabis is a complex plant containing over 100 different compounds called cannabinoids. The two most well-known are delta-9 tetrahydrocannabinol, or THC, and cannabidiol, or CBD. THC is the psychoactive compound that gives users a high, while CBD is non-psychoactive and is often associated with the plant's therapeutic properties. This is where medical marijuana primarily comes from. So how do these compounds interact with our bodies? The answer lies in our endocannabinoid system, a complex network that plays a key role in regulating our physiological processes. In fact, the endocannabinoid system, or the ECS, is known as the master regulator, turning up some neurological pathways while turning others down. It can turn up our dopamine, so we love to eat and play music, and it can turn down the pain signals, so we feel less pain. This system, present in all vertebrates, includes two types of receptors, CB1 and CB2. CB1 receptors are primarily found in the brain and nervous system, while CB2 receptors are more common throughout the body and are predominant in the immune system. Upon the consumption of cannabis, THC attaches primarily to the CB1 receptors, triggering sensations of euphoria. In a lot of users, the euphoria is created by the dialing up of dopamine. Remember that dopamine is our molecule of desire, of thrill and giddy excitement. Certainly the euphoria is pleasant, but it is essential to note a significant side effect of cannabis use: the potential escalation to serious mental health issues. In some users, it can lead to disabling anxiety, particularly those with a predisposition to mental health disorders. The consumption of long-term cannabis can often lead to psychosis. This is characterized first by feeling paranoid, especially in a social context. But it can develop into the feeling of disconnection from reality, even involving hallucinations or delusions and extreme anxiety. Contrarily, CBD doesn't directly bind to these receptors. Instead, it supports the ECS system to enhance its own cannabinoids, referred to as endocannabinoids. Its effect is more subtle. It does not produce a noticeable psychoactive effect other than sometimes helping with anxiety. CBD often tempers THC, counteracting some of its bolder, more intrusive effects, like the aforementioned euphoria and hunger. Let's discuss the effects of cannabis, looking deeper into both the potential therapeutic benefits as well as the possible adverse effects. Many people use cannabis for its ability to provide relief for chronic or acute pain. Mainly, this is the CBD portion of the plant. It's known to interact with pain signaling systems in our bodies, which can lead to decrease in discomfort. It seems to turn down the dial of our awareness of pain. In addition, CBD has been found to be an effective tool for reducing anxiety, helping individuals to feel more calm, relaxed, and less overwhelmed by daily stresses. It can help a person fall asleep. This is in contrast to THC, which can increase anxiety. However, the potential benefits should not overshadow the necessity of responsible use of this drug. It's crucial to be aware of the potential risks associated with overuse or misuse of cannabis. High on this list is tolerance. If using cannabis on a regular basis, like with other drugs, the body will attempt to normalize the experience, making the user require more cannabis to get the same effect. Basically, continued use of cannabis will lead to a decrease in the body's natural endocannabinoids. This means the body becomes reliant on the plant to maintain this heightened state of pleasure, leading to a potential dependency on cannabis. This is how addiction can develop. With the increased use comes another very painful consequence: cannabinoid hyperemesis syndrome. This condition is characterized by severe cyclic nausea and vomiting. Often the only relief comes when the user stands in a hot shower, sometimes for hours in a day. It can be debilitating, greatly affecting an individual's quality of life. Moreover, cannabis psychosis is another serious potential adverse effect of cannabis use. Ironically, while a person may use cannabis to medicate their anxiety, the anxiety can actually worsen. The anxiety can increase to the point of paranoia and psychosis. Another major concern is memory loss. Cannabis affects the hippocampus, meaning that memory loss is always present when intoxicated. But this memory loss can persist after the user has sobered up. In conclusion, cannabis can offer some benefits such as pain relief, anxiety reduction, and assistance with sleep. It is critical to understand the potential risks, including cannabinoid hyperemesis syndrome, anxiety, cannabis psychosis, and memory loss. The importance of responsible use cannot be overstated in order to avoid the potential pitfalls associated with its overuse or misuse. Is cannabis medicinal? The answer is that research is promising that it can be. Both THC and CBD have shown potential for treating a variety of conditions, from epilepsy to chronic pain. We focus more on the CBD because it does not have the same psychoactive effect and is more subtle in its results. However, more research is needed to fully understand their therapeutic potential and side effects. So far, the research shows that cannabis helps with spastic T, neurological pain, and seizure disorders, but the jury is still deliberating on how successful it is on mood disorders and general pain conditions like fibromyalgia. Medical professionals insist that the edible variety is preferred. Not only does smoking cannabis predispose the user to addiction more quickly, but it also destroys lung tissue. It is worth taking a moment to ask this important question: should young people use cannabis? The science suggests caution. Brains are more susceptible to the effects of cannabis, and early use has been linked to an increased risk of mental health disorders. The younger the individual, the more IQ can be impacted, as well as memory. Another concerning side effect is what is known as Amotivational Syndrome. Users often lose their persistence or motivation to carry through complex tasks and their resilience to withstand rejection and failure. Giving up in the face of adversity becomes the norm. This is particularly a problem with the young, who often do not finish school or seek out work or even long-term relationships. And finally, the younger the person is when starting cannabis, the higher the likelihood that they will be a lifetime smoker or user of another addictive drug if the child insists on smoking. Parents should encourage experimentation to occur after the age of 19, if at all possible. In conclusion, with the legalization of medicinal and recreational cannabis across the world, more people are willing and ready to try this drug. Cannabis is often promoted as an alternative to traditional medical treatments such as opiates. The appeal being that there are fewer worries about severe addiction and overdose that often come with pain medications. It is seen as a safer recreational alternative to alcohol or cocaine. It is frequently said that no one has died of a cannabis overdose or a cannabis-related violent injury. At the same time, it's essential to understand that its usage can present certain side effects for some individuals that, while not life-threatening, can still impact the individual in a negative way. Parents have observed that their children become adult teenagers still living in their parents' home into their 30s, too fearful to venture out into society. The key is to approach cannabis with caution and knowledge. Some suggest only ingesting edible versions of CBD and staying away from the psychoactive THC. Others suggest that purchasing cannabis from medical dispensaries may allow some safe experimentation with the varieties of indigo, which is more sedating, or sativa, which is more stimulating. The rule of thumb is to use as little as possible and not on a daily basis so that tolerance does not develop. As a final note, please remember and consider enhancing your natural endocannabinoid system through healthy lifestyle choices. Exercise and eating healthy vegetables and meditation do impact and allow you to increase your own endocannabinoid tone.